Hey there, I just want to spend a few quick minutes walking you through HSG's population-based patient share of care, which can focus on overall patient utilization from patients either associated with your primary care providers, urgent care providers, coming out of your ED, whatever it may be based on a specific patient population. To walk through the outpatient aspect of this and the end user utilization focus, where we have a sample where everything is measured based on a revenue-based metric. So trying to understand what is the total expenditure and spend from that patient population on their healthcare services, where we might, for this specific example, we have this client broken down into 4 specific regions, where we have region A, B, C, and D. We see that over time, the overall utilization spend from this patient population has increased from about 300 million to over 400 million, our capture of which has also positively increased, going from the color of the bar being that we're capturing about 74 cents of every dollar that patient population is spending on their healthcare services comprehensively. We then can look at how does that differ for our priority service lines. So we see we're capturing about 81 cents for every dollar for cardiovascular services, down to roughly 74 cents of every dollar for orthopedic services. If we get into the specifics, maybe we want to understand all of our service lines comprehensively and what does that share look like. Where we're able to see over time, what does that overall spend for that service offering look like, and what is our capture and how is that trending. Being able to then get into the region specifics of maybe we're just looking at just region A for cardiovascular services. So you see we have all of those service offerings. Let's look at just cardiovascular, where we have the ability to see how is that cardiovascular service line trending, specifically from a dollar perspective. And then 2, where are those actual sites of service for those patients receiving that care? Being able to get even in more depth, understand the sub-service line components within that cardiovascular service line. So we have interventional, non-invasive, CV surgery, et cetera, where we can start to understand how is our percentage capture differing, where we're as high as 91 cents of every dollar those patients are spending on their interventional cardiology services we're capturing, down to, if we look at even the imaging and procedure and diagnostics components, the outpatient component of the cardiovascular service line, we're capturing about 86 cents of every one of those dollars. We then once again can look even more specifically at for non-invasive services, where those patients actually receiving that care, and then getting very detailed into understanding how is that differing our capture by either geography, whether that be county-based, and how is that trending over time, or down even into the individual markets and zip codes based on where those primary care providers and their patients are actually located. So within the Tipton market specifically, our primary care providers in that market, their patients are, the services, the dollars they're spending on their cardiovascular services, we're capturing 70 cents of every one of those dollars, while we might only be capturing 57 cents of every dollar from this Indianapolis zip code as the sample represents. So if you have questions on how this might be applicable to you and your organization, or have additional questions, would want to walk through a sample specific to your market, please reach out to me directly. DJ Sullivan, a director with HSG Advisors. I'll be happy to talk through with you further. Thanks.